I used to be a control freak. In a small office, I could hear everything that was going on in the whole office. And it's been a huge change for me to let go. And literally, you have to let go if you want to grow. And so, in the last 3 or 4 years, that's been a struggle. There's been a lot of change. And the change has been good for me personally, because now I come to work, I do the dentistry, and I go home, literally. Everybody else takes care of the headaches and the administration of the office.
In this office, in Dr. Tobler's office, it's ran by team leaders. It's a very cool concept because I've only been in offices where maybe there was an office manager that did payroll and was in charge of scheduling. But here, in every single department, there's a team leader, and they run that department. There's a hygiene team leader, and there's an assistant team leader, and they tell the doctors where to be. We have these great headphones that I took out, and the doctors run around the office being told where to go by the team leaders. So whenever we need something, we call in to our team leader or to the assistant team leader. We need an exam. It's great. It's very unique, different, but it's amazing how smoothly it runs.
I'm Penny. I'm the clinical administrator, which means that I'm the team leader's team leader. And what I do all day is, my job is very administrative. I am watching, monitoring, listening to many of the phone calls that come through the office.
My name is Audrey Milner. I am the front office team leader here at Stonehaven Dental. My job description: I manage a team of people that has everything to do with our front office.
So my name is Erin Henderson. I'm the hygiene team leader for Stonehaven Dental. I am in charge of the hygiene department, which includes hygienists, hygiene assistants, and the hygiene coordinator.
My name is Emily Paystrup. I am the clinical team leader. Having team leaders in our office really allows us to manage our teams well. We have a very disciplined office. It works super smooth because everybody's concentrated on their team.
Our team handles anything from insurance all the way to the new patient experience. All the incoming calls in this office are handled through my team.
Basically, hygiene is kind of the center of customer service because the patients are spending their most amount of time in that area and really connecting with the office, learning to trust our office.
And the doctors just know where to go, and that's part of my job. Tell them where to go, what to do, how long they have to do it in.
I wanted to talk a little bit about how to choose a team leader, because that's the most difficult part of my job. And choosing a team leader is, when you look at your teams, you're not necessarily choosing the very best dental assistant or the very best front desk person, but you're choosing someone with unique qualities. One quality that I always look for is an eye for detail. It doesn't matter that they're the best clinical assistant, but it matters that they can be able to look at the numbers, look at the people, look at the tasks, and make sure that those are happening correctly.
We are growing. We've got 4 operatories. We're growing into a 5th, and we probably will need more soon. Anywhere from 20 to 25 new patients a day, plus all the existing patients, LPA, it's probably upwards of 60 patients a day.
We do about 400 patients, new patients a month.
My team consists of 10 people currently. We're still looking to hire a couple more. We're growing our team simply because we're trying to meet the demands of the patients.
You know, the efficiency factor is because I've got 10 people underneath me, and so we've got somebody to report to their problems, their questions, their concerns. I need more training with this. They can talk to me about that, and I can implement systems, implement training for them in order for them to help them achieve their goals.
And it takes a lot of work to keep that running smoothly. So we have 3 doctors, and we really try and keep them moving all day long. And we have that conversation occasionally. If they try and put their fingers back in the pot, we smack their hands. We just don't. We can't do it. There's no way you can have your team leaders run your practice if the doctors are still trying to maintain control. It's just, you'll ruin your team leaders.
Because we did the old model for 20 years, you can't have growth at our level without the structure of the team leaders. The doctor gets too bogged down in the day-to-day administration, especially in a practice this size. We have 18 operatories and 35 employees.
One of my responsibilities and accountability is to make sure that my staff is trained in a manner that the doctors don't have to worry about insurance. They don't have to worry about the new patient coming through the door, whether their needs are being met. Our doctors here do dentistry. They don't have to worry about whether someone's going to show up or not and cripple my team. That's my job.
That's really important. It's almost the spirit of the team leader and the attitude of the team leader that directs the whole team. And I think it takes pressure off the doctors if they know that it's well managed and that there's a positive attitude in there and that patients are getting a positive experience.
The atmosphere is great. We work with a great team. Nobody has bad attitudes because we're not allowed to, and the rules are you come to work, you're happy, you're busy, and you keep the doctors busy.
I make sure that morale is up so that everybody's excited about their job, and I take pride in making sure my team members are prepared for anything that comes their way.
Well, I pick good people, and we have high standards here, and we do a lot of training.
It's really nice because for the doctors, they come in, they do the dentistry, and they go home.
If you're here, you're happy. And it doesn't matter what's going on at home, we all leave that behind, and the environment here is very happy.
It can make or break you. Your team is your number one, and they have to be right on point. They have to be there 100%. You know, when they're here, we work them hard, and they're fantastic.
We always look at the systems first. When there's a problem in the office, most of the time we are confident in our people. If there's something that's failing, we take a really good look at the system. And we do change systems. It's not our way or your way, it's the best way.
Team leaders is the only way to go. If you're a doctor, get team leaders.
You know, one of the things that's essential to our structure is every Monday morning we have a team leader meeting. And at this time, I do a little in-service where I teach them how to be a leader. And I talk about leadership qualities and just really motivate them and give them the skills. It's amazing to see how these women have grown into great leaders. Exactly. Good people, excellent systems, great results. That sums it up, really.